That was great. And the next app demo is going to be Lieutenant Commander Antoinette Percy-Laurry. She is from the National Cancer Institute, and she will be showing us the cancer survival query system. Please welcome Lieutenant Commander Laurry. Thank you. Welcome.
Good morning, everyone. I am Lieutenant Commander Antoinette Percy-Laurry, and I am speaking on behalf of the Cancer Survival Query System Research Team, which is led by Dr. Eric Roquefort and includes Lori Sinkin and others on the team. The Cancer Survival Query System, which I will refer to as CSQS throughout the presentation, is a physician's resource designed to assist with better understanding and conveying of valid estimates of cancer survival in the context of all causes of death. So this is the medical record of patient John Doe. He is male, white, married, and 73, has just undergone radical prostatectomy, and noted to have locally advanced prostate cancer. He also has other conditions such as diabetes and congestive heart failure. Well, how will his prognosis be assessed? There are two views of a patient with respect to cancer prognosis. There's a chance of dying of cancer or the chance of dying of other causes of disease. Now, in terms of John Doe, the patient with cancer and cardiac condition, the cancer specialist will ask, is the chance of dying of other causes small enough that it is worthwhile to aggressively treat the cancer? And the internist may ask, well, is the probability of dying from the cancer small enough that we should aggressively treat the cardiac condition? Now, the oncologist may understand the prognosis in respect to cancer, and the internist may understand prognosis in respect to other cause of existing conditions prior to diagnosis. But we need to put the two together in terms of how long will the cancer patient live, and will they die of cancer or will they die of other causes? Many previously developed tools have focused on the cancer and treated other cause of death as secondary. But for CSQS, we have focused on the individual and the decisions the patient and physician must make. So we will use CSQS to assimilate John Doe's condition. This is the homepage of CSQS. It tells you about the site and how to use the site, and it provides information on previously relevant websites and calculators that are available to you. The tool is not meant to be used alone, but in concert with other calculators and the healthcare provider. As you can see, there are two cancer modules that are currently available. We have colorectal cancer and prostate cancer. Breast and head and neck cancers are in development as we speak. So I will click on prostate cancer because the patient, John Doe, has prostate cancer. This is a warning box that pops up because this tool was designed for use by for health professionals, and we want to make sure that the person using this know whether or not this is appropriate for them to use. Okay, so this is the disease characteristic. CSQS uses data from the SARE program, which is the National Cancer Institute's population-based registry program. And it also uses Medicare claims data, which is where we get our other causes, pre-existing conditions that a patient may have. Now, this represents about 20% of the US population. So this includes patients who may not be in clinical trials, such as the elderly and patients with many health conditions. This page is asking for staging information. And staging is when the cancer is assigned stage 1, stage 2, 3, or 4, based on how the cancer has spread in the body. And there are two modes of staging. There's clinical and there's pathologic. meaning that some patients are staged from the physician examining scans of the body, and some patients are staged from having surgery and the physician examining the tumor to get exact information. Here, I will select pathologic because that's what's in the medical record. I will continue on to select staging information from the medical record. The Gleason score was 8, and the Gleason score is the cell characteristic. So I will go ahead and select that. I will input the age, which was 73, race is white, marital status is married. And here we come to our health status page. Now, a unique feature of CSQS is computing health-adjusted age. The system allows you to select up to 15 health conditions that a person may have prior to diagnosis. And this is a well-validated standard set of conditions to predict average life expectancy. So if you look at this, and you look at John Doe without any health conditions at all, you'll see that at 73, he's younger than the average 73-year-old because his health status adjusted age is 67. And his life expectancy without having cancer is 16 years. So this is a person that may want to be treated more aggressively. Now, look what happens when I add from his medical chart the heart failure and the diabetes. His health status adjusted age changes to 83. So now he's older than an average 73-year-old, and his life expectancy without cancer is 6 years. So you may want to treat him less aggressively. So let's look at the results page. Okay. All right, so this is John Doe if he had only been diagnosed with cancer. He doesn't have any other medical conditions, just cancer. The results page is easy to understand, it's easy to read. We use pictograms, and it's showing pictogram of 1, 5, and 10-year survival. We included pictograms in our tool because research in health communications literature shows that they're easy to understand. We still have the option of pie charts. You can do that, and you can also customize the years. You don't necessarily have to use 1, 5, and 10 years for after diagnosis. So the oncologist or the internist will look at this, examine the results on the left, and interpret the results. Here it says, looking at 10 years after diagnosis, that approximately 17 out of 100 will die from their cancer, 24 out of 100 will die from other causes, and 59 out of 100 will survive. So for John Doe with just cancer, his survival looks good. Now, if we look at John Doe's results with the congestive heart failure, diabetes, and the prostate cancer, and if you look at the results for 10 years after diagnosis, it says approximately 12 out of 100 will die from their cancer, and 72 out of 100 will die from other causes. Now, the chance of dying from other causes exceeds the chance of dying from the cancer. So this is where the oncologist or the internist, in addition to counseling about the cancer, would also counsel on the attentiveness that needs to be given to the other health conditions. So what is next for CSQS? We are continuing with the development of the system as a tool for healthcare providers. We're working in collaboration with Kaiser and trying the system out in various healthcare settings, such as HMOs, hospitals that caters to lower income patients, and university hospital settings. We also have a call to developers to collaborate in the development of an application that will integrate CSQS with evolving electronic medical records. The EMR app would populate patient data from medical chart into the tool, which would give physicians immediate access to survival statistics. We also have a call to healthcare system providers to collaborate in the implementation of CSQS within your healthcare delivery system. So thank you for your attention. We are the National Cancer Institute, and please visit us at booth 19. Thank you.
Thank you. So it's interesting to me, the need to, I think it's something we need to discuss and explore, not right now, but it's interesting the need to screen this stuff or keep it away from patients. And I think these tools, the real vanguard is going to be making these tools something that patients are encouraged to use, because I think the capacity of patients to engage with this information oftentimes exceeds what we might assume. But I hand it to the National Cancer Institute for putting that together. That tool demonstrates some of the real power of data visualization. I think we've come a long way in terms of data viz.